We are respectful, caring, responsible and committed. We are Team PAH. We are the patient experience.
My name is Shahid Saad. I lead the patient experience team at Princess Alexandra Hospital, and I'm working at the moment together with our teams on our response to the National Inpatient Survey. One of the big issues which has come up is leaving hospital. Very many of our patients, their families, their carers are really keen to get involved in being supported and to leave hospital with all the information that they need. And that's one of the big challenges that we have. And one of the big issues that comes up is that patients feel that they're not communicated with often enough. They often feel as if they are left in the dark about some of the big questions that they have about their condition or treatment. It's about communication. There's no alternative to better communication. If a patient or their family feel worried about anything that they've experienced on the ward, or they feel misinformed or feel as if they don't have enough information, the key thing is to contact the patient experience team. And you can contact us by calling 7211 internally or 01279 827211, or you can email pals@pah.nhs.uk, and we can respond within 24 hours and tell people what's going on, put them in contact with the right people and help them to resolve any issues that they might have.
I'm the transfer of care matron for the discharge team, and I manage complex discharges from the hospital. A lot of our patients are elderly patients, and a lot of them haven't been managing at home. So I think the main concern is from families how they're going to manage after an acute illness in hospital. I think it's communication from when they arrive within the trust. I think information leaflets help a lot. A lot of our discharges, we involve community partners, social services. We work very closely with social services. They're within our own team. And I think communication and linking in with the community actually helps with the safe discharge and alleviates concerns for families.
My name's Maria Walker. I'm a patient journey coordinator, and my role essentially is to be visible on the wards for patients and relatives to be able to liaise with closely with regards to their discharge planning. It's very much about communication, so as soon as the patient comes onto the ward, we greet them, try to keep the families as much as involved as they'd like to be or they can be. We have a communication booklet in the patient's notes now for nurses and people to link in with families and patients if we are not visible on the ward a certain day or over the weekend, and just really just keep them up to speed.
My name is Rachel Harding. I'm a discharge facilitator, which is a senior nurse within the integrated discharge team. My role here at the hospital is to oversee 4 wards at the moment, looking at their discharges and their complex discharges, but mainly focusing on the complex discharges. Within that, a complex discharge would be a change of accommodation, a change in somebody's needs, like a big change in their needs, completing continuing healthcare assessments, mainly dealing with people who are end of life or entering the end of life, and it's getting them to their preferred place of care, whether that be home or to a nursing home. Most of the issues are families' expectations, so maybe families haven't been coping at home for some time, or they've heard that there's something out available in the community that they feel that they're entitled to. So it's about a misunderstanding mainly about what we can provide here at an acute trust. So we've introduced something called Discharge to Assess, which is where the full continuing healthcare assessment, which we used to do here in the hospital, which would take some time, could take up to a week to be completed, will be done out in the community in an appropriate setting, whether that be a community hospital or whether that be in a nursing home that's been designated to be able to manage those assessments.
So my name's Jenny Abel, and I'm the head of transfer of care here at Princess Alexandra Hospital. That means that I look after and lead the integrated hospital discharge team with my colleagues who are from adult social care from both Hertfordshire and Essex. So a lot of our work is about trying to keep patients and relatives up to date with what's going on, where their clinical treatment will end, and they're understanding what then the patient will need at the end of their stay in hospital, so that they can then complete a period of recovery at home. Often it creates a sense of anxiety in how's the patient going to cope when they come home, how has the social network changed as a result of this acute illness. And part of our role is to understand what those needs were prior to admission, what those needs are now that the patient is starting to recover, how we can meet those needs for that period of recovery, and then moving forward, what long-term needs has the patient got that we can then help to signpost and get services ready to start when the patient is fully recovered from their period of acute illness.
My name's Stephanie Newman, and I'm the Voluntary Services Discharge Coordinator, and I work at the Princess Alexandra Hospital as part of the Integrated Discharge Team. I help with all the challenging discharges that prevent people from getting home safely and securely, and integrate them with the outside services. It could be public authorities, voluntary services, and private sector as well. Every patient upon arrival is given a booklet about planning their discharge from hospital, but some people are either too unwell to really take it in, or really are in denial to start the process of leaving because it's a place of safety. So I think just becoming a bit more understanding that they will have to return home, or they will have to deal with their issue, and prepare for that is the best way forward.
We are respectful,
Caring and responsible.
And committed.
We are Team
PAH.
We are the patient experience.